Did you mean to give this one to me too?
Yes.
Okay.
Yep.
Just wanted to make sure.
Yeah, both of those are for your study uses and edification.
Yes.
And these are actually from my Anatomy 1 SI.
Oh, really?
Yeah, so that's pretty cool. Alrighty, here, I guess you can sign in, pass it around the rest of the class.
Those were super packed today.
I know, honestly. I don't know what it is about today.
Ooh, I like this pink.
I know, it's so pretty.
I love writing in pink.
I know.
don't know why.
I do too.
Maybe because it's neon.
I love it. But I do it more, but I'm like, one thing, some people can't see weird colors.
Right.
And then two, like, maybe not everyone wants everything in pink. I mean, I do, but,
right.
You know, maybe guys don't want things in pink.
They'll be fine.
Yeah, they can deal with it.
Right.
Alrighty. So, I mean, I guess we can just pick some questions. Then if you know, whatever questions you have about them, go for it. So, and then for the true or false, you know, you kind of like cover it up and try and answer it. But, so we can do the first one. Arteries, do they carry blood? So arteries carry blood towards the heart while veins carry blood away from the heart.
No, it's the opposite.
Mm-hmm. Yep.
When you write opposites, I remember.
Yep.
The receiving chambers of the heart are the atria, and the forcefully pumping chambers of the heart are the ventricles. True.
True. Yep.
Yes. Which analogy fits the human heart? Oh, I gotta see these answers.
Yeah, this is a multiple choice one.
Okay. I know the answer is there, but it's definitely not a single pump.
Right.
You have two.
Mm-hmm.
Not 4 pumps.
Nope.
Each working at its own rate determined by the needs of the body, sir. No.
Right.
Right, because that basically means that they work separately.
Exactly. That would mean that you'd need 2 essay nodes for number 3 to be correct.
Yeah, okay.
But you only have 1.
Okay, and single, we said it's not single, so it's a double pump.
It's a double pump. Yep.
And they work together.
Yep. Yeah, both pumps beat at the same time, do the same function, but they're 2 separate plumbing systems, basically. Let's see. So oxygenated blood from the lungs to the heart. What are the vessels called?
The pulmonary veins.
Pulmonary veins. Yep.
I have to remember that. I always get the veins and the arteries.
I know. I actually, and it was so stupid, on one of the tests or the practicals when I took anatomy, I was like, I know it, but then I somehow got it wrong. I was like, why did I do
like
this?
Second guess yourself.
I know. Like, why did I do this? It was so simple.
Which circuit of the cardiovascular system is responsible for sending blood to the kidneys, stomach, and pelvic region? See, I wouldn't even know if the answer wasn't there. I wouldn't know.
Well, how many circuits do you have? You have 2. You've got the pulmonary circuit and the systemic circuit.
Okay.
So basically you've got where gas exchange, where you get oxygen, and that's the pulmonary circuit. And then the systemic circuit is the entire body, and that's where you dump out the oxygen.
Okay, so first it goes through the pulmonary circuit.
Mm-hmm.
Okay, so O2 first, and then systemic.
Yep.
That's self-explanatory. Systemic. I'll put dispenses O2.
There you go. Yeah, and then it picks up CO2, brings it back to the lungs.
Picks up CO2.
Mm-hmm. And then it goes back into the pulmonary circuit. And drops off the CO2.
Back to I remember him going over that. I wasn't paying attention.
Yeah, I mean that's a super simplified version, but you only have 2 circuits, pulmonary and systemic.
Okay. Which of the cardiovascular system circuits has deoxygenated blood in the arteries? Pulmonary, right?
Mm-hmm.
Yeah, because it's deep.
Yeah, because arteries are going away from the heart, usually we think of arteries like the aorta, which is going to the systemic
Mm-hmm.
circuit, and that's oxygenated. But arteries going to the lungs,
It's deoxygenated because then it picks up the oxygen in the lungs.
exactly.
Okay.
Yep.
The left ventricle and the aorta are part of which circuit of the cardiovascular system? I know the answer is there,
Mm-hmm.
but systemic
Yeah,
because of the aorta.
exactly. Yep. So right goes to pulmonary, left goes to systemic.
The right aorta.
Right aorta and, well, no, there's no right or left aorta.
Okay.
I mean right side of the heart
Okay.
and left side of the heart, yeah.
Okay, so the right side of heart is what?
Pulmonary.
Pulmonary. Equals pulmonary. And then the left side is systemic.
It's systemic, yeah. So then which side of the heart would have deoxygenated blood in it?
The systemic. No. Pulmonary?
Pulmonary, yeah. And that's the next question is the right atrium and ventricle. Because it picked up, because you've got, so if you imagine the blood starting in the heart, right?
Okay.
The blood is starting in the heart, and it's deoxygenated. It's been all used up in the body. So then it goes to the heart and it's deoxygenated, or it goes to the lungs,
Mm-hmm.
and then it picks up oxygen. So now it's oxygenated again, comes back to the heart, goes into the left side of the heart, and then goes out to the body, loses all of its oxygen, then comes back to the right side, and then goes back to the lungs, and then back to the left side, and back to the body, then back to the right side, to the lungs,
Oh my
back to
gosh.
the left side. Yep.
Okay.
Because you don't want the deoxygenated and the oxygenated blood mixing.
What would happen?
I mean, it'd be very, very inefficient, because then you would be pumping, like, your body would be, like, your tissues would be filled with, like, half oxygenated, half deoxygenated blood. You need, like, twice the blood volume, or twice the hemoglobin, or twice the red blood cells. I mean, you just...
So would that person be considered anemic? Because I know there's different types of anemia, but would they be
Yeah.
considered anemic?
I mean, that doesn't really happen.
Mm-hmm.
Blood, like, I don't think that happens at all. Oxygenated, deoxygenated blood mixing. I mean, well, you can have problems absorbing oxygen and stuff. Yeah, you probably would be considered anemic.
Because if you need more hemoglobin.
Mm-hmm. You need more oxygen, yeah.
Yeah. Okay.
Yeah, I had to think it through because it's like, I don't think that really happens.
I'm sure
It's-
there's one person on this
Yeah, I'm
planet
sure
Earth
it's super common,
that has
super
that.
rare. Yeah.
Alright, so which heart chambers would contain deoxygenated blood? Right atrium and right ventricle.
Mm-hmm. And it's, you know, it's convenient to draw like a little diagram of
Okay.
like, here actually, I can draw it right now because I want to. You can do something super simple. Like this is left and this is right. Actually, it's the opposite way around because we're doing anatomical position. Right and left. So then, which one is deoxygenated?
The right.
Right side. Yep. My gosh. And it's pulmonary. And the left is oxygenated and it's systemic. So then, this is a horrible analogy, but you can imagine that it's divided. This side is deoxygenated and this side is oxygenated.
And then systemic. Oxygenated is the right side.
Mm-hmm. Wait, no.
Wait,
Oxygenated is the left side.
systemic.
Systemic.
See, that's what throws me off because I think of pulmonary and I think of oxygen.
Mm-hmm.
So,
But we're referring to the blood before it gets oxygenated.
okay. Right, -O2 on this side.
Yeah, but I can see I can see where that mess you up.
Yeah.
Like pulmonary, it's like it's getting oxygen. Yeah. So it is double-sided.
Mm-hmm. The epicardium is another name for. See, I wouldn't have known that. The visceral layer of the serous pericardium.
Mm-hmm. So what is the pericardium? It's like the little sac that the heart sits in.
I was gonna say
Right?
layer. Mm-hmm.
Yeah, it's like a little water balloon, and then they just put the heart inside the water balloon, and the water balloon kind of curls over it, kind of envelops it, so it's not sitting in the water, but it's like the water balloon's like around it. So the part of the water balloon that's touching the heart
The heart is the visceral layer.
is the visceral layer, yeah.
And
But
then-
then imagine it's glued together, so the visceral layer is also the outside layer of the heart.
Okay, and then the inside would be the parietal, right?
The outside.
The outside.
Mm-hmm.
The outside of the whole thing,
Of the whole thing, yeah.
including the sac.
The outside of the sac.
Okay.
So here. So we've got our sac, right? And it's kind of sits around the heart like this.
Mm-hmm.
And then there's an inside layer too that's super close and that's attached actually to the heart.
Mm-hmm.
So the heart has 3 layers. It has the endocardium and the myocardium, and then the epicardium, which is on the very outside of the heart,
Okay.
right? And the myocardium is the muscle, and then, yeah.
And those.
Mm-hmm. Yeah, so this is the sac, right? The serous pericardium sac. So the epicardium is also the visceral pericardium.
Okay.
It's the inside layer of the sac. The sac is literally fused to the heart.
Okay.
So it's just 2 different names for the same thing.
Gotcha. Okay.
Yeah, it's kind of weird. Like, why can't they just name it one thing?
That'd be too easy.
It would. It'd be way too easy. So what does the fluid inside do?
It lubricates.
Lubricates, yeah. So that you don't feel your heart beating all the time.
It's gotta hurt. It's gonna
Yeah.
suck.
They had to cut that for Dr. Sacknick to do his heart surgery.
I know, he was
Yeah.
saying, yeah.
I'm not into that.
The layer of the heart wall composed of cardiac muscle tissue is the cardiac muscle, so the myocardium.
Exactly. Yep.
So highlight muscle. The fossa ovalis appears just above the opening of the coronary sinus within the. I don't want to look at the answer. I need a diagram.
Well, what is the coronary sinus?
Aren't those the like little holes?
It's a little hole, yeah, but it's carrying all the deoxygenated blood from the coronary system. So the system that actually feeds the heart itself.
Okay.
So it's bringing all of the deoxygenated blood that has just fed the heart, and is dumping it into which atrium?
The right.
The right atrium. Yeah. So knowing that, you can now think of the answer and realize that if it appears just above the coronary sinus, it has to be in the right atrium.
The right.
Yep.
The papillary muscles attached to the cusps of the atrioventricular valves by means of the. I don't even get the question. The papillary muscles attached to the cusps of the atrioventricular valves by means of the.
So the little valves, the little muscles that open the AV valves.
And the tricuspid and bicuspid.
Yeah, so how are those muscles attached? What are like the white ligament string things
Oh man.
attached to those?
That was like the first thing I knew. First thing I
Cords, they're like cords.
heard. Yeah, they're like stringy little thingies.
Mhm.
Like little ligaments. I don't remember.
Chordae tendineae. I know. Just think of them as cords though,
Yeah.
like little ropes. That was one of my favorite words, so for some reason I always remembered it. I was like, oh, I like that one.
The each ventricle displays large, smooth, irregular muscular ridges called trabeculae carinae.
Yep.
Should have known that one. I had to look.
Yeah, that one's kind of a vague one. This practice test is definitely more in depth because it's like there's like 70 in just the heart, so we'll probably skip over the blood eventually, just so that we can get like a little bit of diversity. But let's see. What are the cell-to-cell contacts of the cardiac muscle fibers called? So the cardiac muscle fibers join together, and where they join together, it's called. It's some kind of disc. It's number 16. It's an intercalated disc.
Intercalated.
Mm-hmm. You can think they're interlocked together by intercalated discs.
Interlocked?
Yeah, because the cardiac muscle cells have those branches, right? And they look like they're all interlocked together.
Mm-hmm.
So you can kind of think interlocking cells have intercalated discs. Let's see. Which action leads to the closure of the right atrioventricular valve?
What was the question? What number is it?
19.
Which action leads to the closure of the right atrioventricular valve? I'm gonna look at it. Contraction of the right ventricle.
Yeah. So why would the atrioventricular valve? So the AV valve, where is that located?
It's right in between the atrium, the right atrium and the right ventricle. So
Exactly. Yep. So when the ventricle contracts, why would that one close?
When the right ventricle closes?
Contracts, yeah.
Contracts.
Mhm. Why would that valve between the atrium and the ventricle close?
So that the water.
It's mostly water.
The liquid, the blood doesn't go back up to the atrium.
Exactly. Yeah. It uses pressure.
Okay. So I don't know if you know, but if that doesn't close the atrioventricular valve, would that be considered a heart murmur?
Yeah, and sometimes it doesn't close all the way. Yep.
Back
Sometimes
and
it
forth.
doesn't close all the way. Sometimes it's broken in some way,
Yeah.
and that's a heart murmur.
My dog had one and I heard it.
Yeah.
I put my stethoscope
Really?
to him. Yeah, and
Aw.
I heard it was swishing. I'm like, it's a heart murmur. He's fine now.
Yeah. Aw.
He's still kicking. 3 years later.
Aw. Let's see. Which valve prevents the backflow of blood into the left ventricle when the ventricles relax?
Bicuspid. Right.
Not bicuspid. That's the AV valve. We're talking about
Wait, what question are we on? I need to see it.
20.
20?
Yeah. So the ventricle is connected. The ventricles are connected to the arteries, right?
Mm-hmm.
In both systems. So then, which system is the left?
I don't want to look at the board. The left would be systemic.
Systemic, yeah.
Okay.
So what's the artery connected to? What's the big artery connected to the left ventricle? It's the main systemic artery.
Aorta?
Mm-hmm.
Okay.
Yeah, so what's the valve between the aorta and the ventricle?
Aortic valve.
The aortic valve or the aortic semilunar valve?
Semilunar.
Yeah. I always think semilunar, the moon is above us,
Mm-hmm.
and the semilunar valve is above the AV valve. Like the semilunar valve is on top of the heart.
Okay. Let's try to remember that.
Yeah.
I did that one already.
Let me find. SA nodal cells are autorhythmic. True or false?
I just thought so true.
What does autorhythmic mean, do you think?
I have no idea. Something with the rhythm of the heart.
Yeah. So,
Like
what does the SA node do? What is the SA node?
the pacemaker.
Pacemaker. So, what would autorhythmic mean? Because the pacemaker generates the heartbeat, right?
Mm-hmm. So would it be like the natural rhythm of the heart? No?
Kind of, yeah. It means it makes its own heartbeat. So like auto, it does it automatically.
Automatically.
Yeah.
Okay.
Let's see.
I saw one that he wrote down.
Mhm.
We'll go over in class.
Oh.
Yeah.
Interesting.
Like the answer wasn't there.
Oh, I see.
I don't
The
know.
shedding of the semilunar valves.
I don't remember what question it was though.
37.
Oh, I'm way off. I'm in the 60s. Ah. Of the semi-lunar valves.
Yeah. So what do the semilunar valves separate?
Which one is in there too?
There are two, but they're both in the same, like if you think in general terms, like artery, vein, ventricle, atrium, where are these semilunar valves located?
Between the ventricle and the aorta?
Yeah, between the ventricle and whatever artery.
And the artery.
Mhm, yeah. So between the ventricle and the artery. So
So would it be during the late
like what?
ventricular systole?
Ventricular systole. What is systole? Is it contraction or relaxation? Relaxation.
Hold on. That's contraction.
Contraction, yeah. So you don't want it closed while the ventricle is still contracting,
Okay.
because then all the blood would just not go anywhere. So you don't want it during while it's contracting, but then when the ventricle is relaxing, you don't want blood to pour back in. So then it would be ventricular diastole.
Late ventricular?
I'm pretty
Or early?
sure. Pretty sure it's late, because some of the blood actually does leak back before, because the valves are like little little leaf shapes. And this is really awkward, but they kind of like, hold on, they kind of open like this, right?
Mhm.
So they open, and then if you imagine the walls of the artery are right here, once blood starts pouring in here, they like fold.
Mm-hmm.
So blood has to start flowing backwards in order for those to fold.
Okay.
So a little bit of blood gets in, but then once enough blood gets between the valves and the wall, then they close.
Then they close.
I'm pretty sure it's late ventricular diastole. I can double check once we're done. I just want to make sure that I'm right.
Yeah.
Let's see. Oh, so something that I caught. Do you know what a chronotropic effect on the heart is? Because you mentioned that in class.
Mm-hmm.
So chronotropic. Remember we had tropic hormones that affected how other glands released hormones,
Mm-hmm.
like gonadotropin hormone. So tropic just means that something is affecting something else to do its thing. So then chronotropic, chrono means time.
Mm-hmm.
So it's something that affects the rhythm of the heart. Something that changes the rhythm of the heart. Because the heart generates its own rhythm, right?
Mm-hmm.
So a chronotropic, stimulant, or a chronotropic, I almost said relaxant. A chronotropic something, like a chemical, would change how the heart beats, would change the rhythm of the heart.
Mm.
Yeah, it's interesting. So that's what chronotropic means.
Okay. Changes the rhythm of the heart.
Yep. Let's see. The left ventricle walls are typically thicker than the right ventricular walls. True or false?
True.
True. Yep.
It's more muscular.
Yep. Because it has to pump harder to do
Yeah.
the same amount of work. Exactly. Let's see. Oh, the visceral pericardium is the same as the epicardium. Yep. And blood is supplied to the myocardium by the
You got me there.
So what does coronary mean?
I don't know what I mean.
So the coronary arteries are the ones that feed the heart itself,
Mm-hmm.
right? Yeah, that's what I meant. I don't know what the word means itself, I just know they feed the heart. Yeah. So the coronary, so the blood that's going to the myocardium is supplied through the coronary arteries.
Okay.
Because the heart needs its own, it needs its own blood,
Mm-hmm.
or else it'll do one pump and then die. So you die like immediately before birth. Let's see. And I don't know how in depth he wants you to know the coronary arteries. I feel like there might be like one question
Yeah.
about
He
the
didn't
coronary
really,
arteries.
I don't remember him really talking about
He didn't
coronary
really.
arteries.
So I would just go through the coronary arteries and just know there's like 3 big ones I think he wants you to know, but don't spend a ton of time on
Yeah.
them. There'll probably be one question, if any questions.
Part of the practical will be a little more, but
Maybe. Maybe not though.
yeah, hopefully not.
Yeah. So let's see.
73.
73. Alright.
Pacemaker cells in the SA node. It doesn't have the answer, so.
Oh, okay. Pacemaker cells in the SA node. FA node. Alright. Well, what's your guess?
The first one?
Not the first one. So they actually have an unstable resting membrane potential. So were you did I like draw out the SA node chart, like the diagram for how the signal goes?
I think
I
so.
don't. Did I? I'll draw it again. So normally we're talking about a signal, right?
Is it this
No,
one?
that's the pressure. That's the pressure graph.
Oh, okay.
So normally normally when you have a signal fired through a cell, right? Like a neuron, the graph looks like this, right?
Mm-hmm.
Well, in the SA node, the graph looks like this. So it's said to have an unstable resting potential because it actually goes back down, and this is where your threshold is, and then right here, this is where the threshold is. So this little upwards climb, calcium leaks in sodium leaks in super slowly. So instead of closing all the sodium channels and waiting to be depolarized like this one,
Mm-hmm.
there's always sub open. And so it's always a little bit unstable. It's always changing.
Okay.
So sodium leaks in, and then once there's enough sodium, boom, and then it goes right back down. And then it leaks in, boom, right back down.
Okay.
So it has an unstable resting potential. And then the SA node, are the cells in the SA node the ones that contract to make the heart beat?
I want to say yes.
They're the pacemakers. They generate the signal.
Okay, but they don't actually.
Mm-hmm. Yeah, so they're not concerned with making the heart beat. It's such a small patch of cells, it
Mhm.
wouldn't do really anything.
Okay.
So, and it generates the action potential that spreads through the entire muscle. So it goes from the SA node to the AV. So the SA node sends a signal over to the other atrium and then to the AV and then to the bundle, then the bundle branches, then the Purkinje fibers.
Mm-hmm. So it's the second one?
It's the second one, yep. The volume of blood ejected from each ventricle during a contraction. What is that called?
Each volume?
The volume, yeah.
What number is that one?
It's actually 72.
Right above it. I want to see the answer. The volume of blood ejected from each ventricle during a contraction is called. I don't know.
Called the stroke volume.
Stroke volume.
Yeah, because each beat is a stroke. And it's how much blood you're pumping out of the ventricle with each stroke. So if you have a low stroke volume, it means that you're pumping out less blood than you should be, or than you could, out of the ventricles. If you have a high stroke volume, it means you're pumping a lot of blood. It's very efficient.
Okay.
And you want to be efficient. Because you want your heart to work right. At least I do. Oh, depolarization of the atria corresponds to the ECG's what wave?
Depolarize?
Mm-hmm.
The P wave.
The P wave, yep. And then the repolarization, this is just a question I made up. The repolarization is of the atria. You can't see it, it's hidden somewhere in the ECG.
Are you asking like where?
Where
on the EKG
yeah,
you would
yeah.
technically it would be?
Yeah, I kind of like said it in my brain and realized I didn't say it out loud.
It's the QRS,
Mm-hmm.
right?
Yep.
That's the one that's hidden.
Exactly.
Okay.
Yep. And I don't know what order this goes in. Oh my gosh. Let's see. Do some blood stuff.
Yeah.
Blood helps regulate the pH and the temperature of the body. True or false?
Which one is that one?
Number two.
Temperature of the no. Which one? Number 2?
Number 2.
True?
True. Yep. Yeah, because with the pH, remember the CO2 breaks down into acid in the blood. So that affects pH because pH is acid. Is a measurement of how much acid.
Right.
There it is. Yep. And it regulates the temperature. Let's see. I don't think he mentioned anything about the temperature of the blood itself.
I was gonna say.
Yeah.
Which one is it?
Number 4.
But which answer is it? Do you have?
It's B, I think.
See how?
Wait. Oh, see, I don't know because I never learned it because
Okay.
this may be. I mean, this is from like 2016.
Yeah.
His other SI made this in 2016, so he probably changed things a little bit. Let's see. How much blood does an adult body typically contain?
Well, women are 4 to 5 liters and men are 5 to 6.
Mm-hmm. So what's the average?
5.
5. Yep. Exactly.
Cool.
When blood is centrifuged, its components separate. The bottom of the tube holds the.
The plot. I'm trying to picture it.
I know.
can't. My brain isn't working. I don't remember if the blood is on the bottom. Okay, I'm gonna look. What question is it?
It's the last question on the first page. What is it? 8. It's the erythrocytes.
So the blood.
The red blood cells.
Red blood cells.
Because it's all blood,
No, yeah. Red blood cells.
but the red part of the blood.
That's what.
I know. Let's see. What is the most numerous of the formed elements?
What do you mean formed elements?
Formed elements like the cells and the platelets.
Oh. The most numerous?
The most numerous.
Would that be the red blood cells?
It would be. Yep.
Erythrocytes?
Yep.
What number 7?
That's 10. Yeah, the formed elements are cells and platelets,
Okay.
and then the not formed elements is everything else. Let's see. Oh, what's the smallest and most abundant plasma protein? He kind of mentioned it.
Albumin.
Albumin.
Says here.
Yeah. Yeah, I don't, that,
Yeah,
if
what
he,
is it?
when we do vessels, that'll actually come up, the albumin.
I just know
So-
albumin is what we check for when a patient has high blood pressure. We check their kidney function.
Yeah,
So
because,
microalbumin.
well, because albumin actually, if you have too much albumin in your
Mhm.
blood, it attracts water. It
So
from
you retain
tissues.
it.
Yeah, you retain water in your vessels, so you'll have a high
Ah.
blood pressure. So if a patient has too much
Gotcha.
albumin in their blood, they attract water from their tissues that shouldn't be in their blood, and so then their blood pressure's higher. If they have low albumin, they're not going to keep as much water, and they're going to lose water to the tissues. They're going to have edema, and they're going to have
Mhm.
low blood pressure.
Oh, Lord, okay.
Yeah. So that's why you check for albumin.
Yeah, okay.
Let's see. What does the hemoglobin carry?
Oxygen. I know
Mhm.
that. Carbon dioxide.
Yep. Yeah, oxygen, carbon dioxide.
I know 21, he would, but that'd probably be on the test.
Yeah. Yeah, I would definitely know there's 4 oxygen molecules for every hemoglobin.
And number 22.
Yeah,
And the globins, or globin.
the globins.
The globin. I feel like that would be on
Yep. Yeah, and there's, because there's one iron per globin,
there. Mm-hmm.
so 1 oxygen per globin. Let's see.
Nope, 23, that would probably be on there.
Yeah, liver and spleen.
Number 24, which one is it? I have 3 answers here.
Yeah, it's all 3.
Oh. Oh, more than one choice is possible.
Mm-hmm.
See, I don't read the questions.
Because it doesn't have any other antigens.
Which are
On itself.
characteristics of type O blood?
Because it doesn't have A on itself and it doesn't have B, so it's going to fight against both. It's going to have antibodies against both. Which is kind of crazy that our blood does that, because normally in order to like fight against something immunologically, however you say that, your body has to be exposed to it first. But the blood somehow knows that there's, like, when you're born, before you've ever, seen anyone else's blood, before your blood has seen it, it knows that there are 4 types, and knows which type it is, knows which type it's not, and will fight against the other ones. So it's the only, it's like the exception to the rule. It's really
Yeah.
cool. Let's see, what is this? If agglutination occurs after a blood transfusion, it may indicate
If what?
agglutination. It's like coagulation.
Occurs after blood transfusion and may indicate. DVD. The wrong blood type was used. So.
Mm-hmm.
Okay. Should have known
What is the main function of leukocytes?
that. To fight infection.
Yeah, defend against pathogens, basically. Let's see, which type of leukocyte releases histamine?
Eosinophil.
Not eosinophil.
Basophil.
Basophil. Yep.
One of those.
I feel like eosinophil does release a tiny bit, but basophil is the one we care. It's the one we talk about.
Yeah, because the nurse practitioner that I work with, she's like, it's also eosinophil, and I'm like, don't confuse me. That one
Yeah.
fights some parasites, and basophil is
Mhm.
histamine. She was like, but also no. See, now I'm confused.
Yeah, but the question, if he didn't give you two possible answers, the correct one would be basophil.
Basophil.
Mhm. Let's see. What type of leukocyte will migrate into the tissues and take up residence there? Monocytes.
Those are the ones that eat everything.
Yeah. So the monocyte are the huge macrophages,
the
right?
big ones. I was
Yeah.
gonna say the big ones. I didn't know
Mhm.
any of it.
So when they're in the blood, they're called monocytes, and then once they migrate, once they get into the tissues, they actually establish themselves, and they like take up rest. They like make a home in whatever tissue they're in, and then they're called macrophages, because you can't call them the same thing, apparently. Because that would be too easy again.
Yeah.
Mhm. What are the most numerous of the leukocytes?
Never let.
Neutrophils. Yep. What's the least numerous? Bananas.
Basophil.
Wasn't that on the?
Yes.
On the
Yes. Yes. That's the only
monkeys.
one that I got wrong. I was like, oh my god.
You were not the only one. There were several people mad about that.
And what's funny is that I looked at the phrase, but I didn't read the question.
Oh.
So it's not like I read it and I misunderstood it. I didn't read it. I saw never let monkeys. Yeah, it was never let blame eat bananas. I was like, oh, monkeys. Ah. And then when he told us to switch the papers, I read it and I was like, oh my god. The only one that I got wrong that day.
Hey, at least you only got that one wrong.
I know. And at least I knew the answer.
Yeah, you'll get it right in practical.
Put it wrong. I hope so.
You will, don't worry. What's the first phase in hemostasis?
I was just looking at that question.
Yeah.
Vascular spasm.
Vascular spasm, exactly.
Blood vessel constriction, the first phase of hemostasis.
Yeah, blood vessel constriction, vascular spasm, it's the same thing.
Yeah. Oh, this intrinsic and extrinsic.
Mm-hmm.
I don't understand it one bit.
The intrinsic and the extrinsic pathway.
Yeah, I don't understand it like one bit.
It's basically two different ways of accomplishing the same thing. So, yeah. So it depends on what kind of injury you have. So if you literally like make a hole in, we did this in,
Yeah, you went over this. Let me
Yeah.
see if I can find
find your notes.
the drawing that. There's a mess. I don't know where anything is. I remember you drew it. You drew the cut on the board.
Yeah. Really hoping this is still recording. It is, yay.
I'll find it. Somewhere. Or not. But I know I have it somewhere.
Mm-hmm.
This notebook is a mess. I just opened a blank page and start writing.
It's just whatever.
Yeah.
Whatever you decide to do.
Pretty much.
Okay.
On it.
Yeah, so the extrinsic pathway is when you actually like pierce a hole in the vessel. So you have blood leaking out of the vessel. Extrinsic.
Extrinsic. Okay.
So it's like a pipe. If you burst the pipe, you have an extrinsic wound.
Because you have a leak.
Water's going out.
Okay.
It's exiting. So if you have an extrinsic wound, then
Exit.
Exit, exactly. There you go. So if the blood is exiting, then you have one clotting pathway that's activated,
Mm-hmm.
and it activates the fibrin and makes all the stuff happen. And then if you have an intrinsic wound, it means you damage the endothelium,
The
inside. The inside. So it's like the pipe, but you wore the pipe down. It's thin.
Okay, so exit and inside.
Exactly.
Let me write that. Extrinsic. Exit.
you have,
Okay.
and that's the path is activated. And then once you get down to actually making, once you get down to my gosh, what is the thrombinase?
Mhm.
Then which is gonna make the thrombin happen.
Mhm.
Then it actually activates both pathways. So no matter what kind of wound you have, so if you have an extrinsic wound, once you get down to the spot where they both do the same thing, then the intrinsic pathway is activated too, to give you two different ways to do the same thing.
Okay.
And then the common pathway is just when they start doing the same thing.
Okay. Which one is that?
Um,
Oh, is that not a question?
it's kind of part of a question.
Number 41.
Yeah, number 41. Yeah. Yeah, so basically both paths lead to fibrin.
Yep. Fair.
Let's see. The combination of plasma and formed elements is called
Whole blood.
whole blood. Yep, just all of the blood.
Yay.
What are platelets? Are they cells in themselves?
No.
No. But they have cellular material in them.
That's mainly water, right? Is that the one that's mainly water?
Yeah, it's mainly plasma. So where do platelets come from?
Don't know.
They're little fragments of cells. So they're the ones that the megakaryocytes in the red bone marrow, the huge, they're like gigantic cells
Mhm.
that have growth factor all the time. They don't have an off switch, and they just grow and grow and grow. And then the plasma grows super fast, and it's just producing more and more plasma. So little bits, the plasma eventually gets so big that it like bursts in little bits of plasma and little like flakes of cell
Mhm.
just rush in your blood, and that's a
Mhm.
platelet. So like it's literally a fragment of a megakaryocyte,
Yeah.
which is kind of creepy.
Pretty sure 49 will be on the test.
Yeah, the albumin. A plasma protein essential for blood coagulation is number 50.
Fibrinogen.
Fibrinogen, yeah. So remember, fibrinogen is the fibrin with the cap on it. It's a little piece of the fibrin.
Yes.
Yeah, it's the building blocks of fibrin.
Yeah.
Yep. What is the most abundant component of plasma?
Water.
Water. Stay hydrated, unlike me. Let's see.
Which is not a component of plasma.
Mm-hmm.
Platelets.
Platelets, yeah, because they're a formed element.
Platelets are?
Yeah. Remember red blood cells, white blood cells, and platelets are formed elements.
So they're kind of like your primary colors.
Yes. It's like things that were made it's like things that were made for the sole purpose of sitting in the blood. Or things that were made specifically for the blood. And then everything else is just kind of in transit. It can be in the blood, it cannot be in the blood, it can do a bunch of different things.
Yeah.
But the formed elements are like, this was made just for the blood.
Okay.
So yeah, it's like the primary colors, and then you have like all the little extras that you don't technically need, but that are nice to have. I mean, you need them all, but you get what I'm saying.
Yeah.
Yeah.
They're like the originals.
Exactly. Yeah.
It's just one of these not formed elements of blood antibodies.
Yep. So what is each heme ring in a hemoglobin?
What is what?
A heme ring in the hemoglobin. So remember you have the globin and then you have that little ring that has the ion in the middle of it. What is that ion? It's what oxygen binds to. Iron.
Oh my god.
So you got the globin, which is like the protein, right?
Mm-hmm.
And then inside of the globin, you have this little ring. It's like a little disc of just chemicals. You don't even know what they are. It's like carbons and oxygens and stuff. And then in the middle of that, you have your one iron atom. So the iron is inside the heme, which is inside the globin. And then if you put 4 of those like sets together, you have one hemoglobin.
Mm.
Yeah. So you can carry 4 oxygen molecules. It's crazy.
I know. Now I'm thinking like, all these anemic patients we have. So are like 4 not stacking up?
Sometimes the hemoglobin doesn't form right. Sometimes you just don't get enough iron in your diet.
Yeah.
And if if you bleed too much, you lose iron. Anemia doesn't also have to do with iron.
Mm-hmm.
If you're just not producing enough red blood cells, or if your red blood cells are shaped the wrong way, there's so many things that can happen. It's crazy. Yeah, but definitely, I realized like vegans have a really hard time with anemia. Like my sister went vegan and she did everything right. She ate all the foods and she just still couldn't do it.
Yeah.
She's like, I'm not getting enough iron.
It's like people that do all these keto diets, like you're gonna go into kidney failure. Stuff
Yeah, like keto can be good for a while.
But you have to. There's a certain way to do it. You do it for like a certain amount of weeks, and then you stop, and then you pick it up again, and then you stop. There's people that do it for long term.
You're meant to eat a balanced diet of everything. You're not meant to eat just one. Like you're not meant to like throw out 2 food groups and just eat 3
Yeah, like
for the rest of your life. Like we're just not made for that.
yeah. And if you don't do like your research on it, it can be.
Fad diets are a thing, and they can be really harmful.
Yeah, you'll pay for it later when you're on dialysis. Like you went into kidney failure because you wanted to be skinny, but
Yeah.
instead of just stop.
And it's good. I mean, it can be good for a while.
Yeah, you're supposed to like do it for I think 6 weeks and then stop for 6 weeks and then pick it up again. It's something like that, but
See, I haven't looked into it.
it's not.
I
like
just
it's
know
not a
you're
long
supposed to eat
term.
fruits and vegetables. Don't eat things in a box. Eat more fruits and vegetables than box foods.
Okay. Yeah, there's a certain way to do it. But
Yeah.
If you just do it continuous, eventually you'll want to like kidney failure.
I mean, it makes sense. Your
Yeah.
body's not designed for that.
We have a patient who does it.
Oh, really?
Yeah, and we can tell because of her urine. Well, her urine came back. I forgot what it was, and the doctor was like, "Yeah, she does a keto diet."
Oh, wow.
So I'm like, "Oh, I don't remember
Interesting.
exactly what her UA said, but
Huh.
stop doing it."
Interesting.
Mm-hmm.
Yeah, I didn't realize keto had that detrimental of an effect long term. I know a lot of people who are on keto.
Yeah, kidney failure. You have to do your research before
Yeah.
just jumping in. You can't just how vegans. You can't just jump into it. Like, you have to do your research and your supplements and what foods to eat, and it's a whole other job.
Yeah,
Just
it really
eat.
is. I know. Honestly, I don't have time for that.
Yeah, no, just eat it. I mean, you can still eat healthy.
Mm-hmm.
Doesn't have to be technically a diet.
Eat lots of fruits and vegetables.
Eat just sugar. I mean, your body can't really tell the difference between artificial and natural sugar. You would think it can, but it's not that smart.
It can't. Well, yeah.
Sugar.
It processes it the same way, but
yeah, unfortunately.
it's what it breaks down
that'd
into
be- Yeah.
that affects you. So it's weird.
Yeah, and all the chemicals they put in the artificial stuff. If only your body knew.
Yeah.
Like, no, this is fake. No, that's real.
I know. Like, don't absorb this.
Exactly.
Yeah. Where does erythropoiesis take place? What is erythropoiesis?
Isn't it the protein?
Not the protein. So what's the first? It's what is it? 64. So erythropoiesis.
I know this, but not right now.
erythropoiesis, red blood cell formation, erythrocyte formation.
Oh.
Yeah.
I need to go and take a nap.
Don't we all?
Yeah, I'm so tired.
My mom took a nap today. I
Nice.
walked into her room and she's like, I just woke up from a nap.
Yeah, I was texting my mom when I was at work, and she was like, "Can you leave me alone? I'm sleeping." She doesn't work today, so I'm like,
It's like, I'm at work.
yeah, she's off Mondays.
Alright, let's see what else we People with type AB blood are considered the universal recipient for transfusions because
Hold on, I know.
you got it. So if you have AB blood,
Mm-hmm.
your body
It's like right there. I know you did that diagram.
mm-hmm. Oh, that was the video where it cut out on me 8 minutes through.
The blood one that we did?
Yeah, that's when the
diagrams?
video cut out 8 minutes through. And I actually stayed for an hour after that, re-recorded it by myself.
Oh my god.
I was like, I'm not doing that again. So now I put my phone in silent. Like airplane mode.
Okay. Is AB?
It's AB, yeah. So it's the universal recipient
Right.
because it won't attack either A or B blood. Because it has both. It has both antigens.
And O is a universal donor. O negative.
Exactly. Yep. Because it doesn't have any antigens on itself.
Mm-hmm.
So AB blood won't attack A, B, or AB because then it would have to attack itself.
Okay.
And-
it has both.
Yeah, and it can also accept O blood. And anything can accept O blood because there's nothing to attack.
Right. Okay.
Yep. So poor people with O blood. They can't accept anything but O.
I want to say I'm AB positive, but I'm not 100% sure. So I'm good.
Yeah.
I'm okay.
Yeah, I tried to take the test. Did I tell you guys I tried to take a home blood test?
That 23andMe thing?
No, it was when I did human anatomy in high school.
Uh-huh.
And I got like all worked up. I was like, because you had to prick yourself with a needle and then put it on the, put it in the whatever. I don't
Yeah.
remember what it was. But and then it would tell you like you gotta put spots of blood on it. And it would tell you what you are, right? And I was
That's
like
how I
for
did
like 20 whole minutes at least. I was like, no. I was like, I want to do it, but I don't want to do it. I want to do it, but I don't want to do it. And so finally, my friend was like, Linnea, just let me poke you.
Oh my god.
So finally, I let him do it, right?
Yeah.
I was like, oh, it wasn't that bad. And then we put it on, and the test was done. I was like, of all the things, I stress and struggle over this. Finally, be brave, and then it's done.
I think that's how we did it.
Yeah.
With the little smear thing.
Yeah. So I don't know. I wish I did, but
Yeah, it'd be good to know. Why do I have 6 emails from my school? They keep saying or letting us know that the Daytona campus doesn't have power. I don't care. I'm not there.
which white blood cell would you expect to find if you have a bacterial infection?
Neutrophils?
Mm-hmm. Yep. Neutrophils are the ones that eat the bacteria. Oh, red blood cell production regulated by the hormone is almost the same, literally almost the same word as red blood cell formation.
Erythroprotein.
Yes. Erythropoietin or poietin.
Poietin.
I don't know. I like saying poietin.
Where's the what question?
It's 73. In 74, he said there's not really anything you need to know about colony stimulating factors.
Okay.
Just know that they're there, but they're hormones that regulate blood cell formation. Let's see. And there's the megakaryocytes in 76.
Mm-hmm. Giant. Highlight giant.
Huh?
I said I'm gonna highlight the word giant.
What's the little knife that's gonna convert fibrinogen to fibrin?
I gotta find it.
It's the enzyme that I was thinking of. Prothrombinase, that's what it is. I know someone's gonna call me out on the video.
The little. What is it you're asking?
Like the knife, the thing that converts fibrinogen to fibrin. So it's the thing that cuts the cap off.
Fibrinogen to fiber. I have it here and I don't understand.
It's thrombin. Yeah. So remember the prothrombinase has to cut the cap off of the thrombin to activate the thrombin, and then the thrombin can go cut the cap off of the fibrinogen and let the fibrinogen bind together and make fibrin.
Okay.
So, but when you're talking in more scientific terms, where is it? What am I looking at? Oh, thrombin is an enzyme, right?
Mhm.
It's not just a little triangle.
Yeah.
So, but it converts fibrinogen to fibrin. Yep. What is fibrinolysis?
It dissolves clots.
Dissolve clots, yep. Where do platelets, what do platelets adhere to in damaged tissue?
Adhere to collagen.
Collagen, yep. And which of the following vitamins is needed for the formation of clotting factors?
K.
K, yep. Vitamin K. Yeah. That's why when you have surgery you can't eat too much. You have to like regulate your vitamin K intake. You can't do supplements or anything.
Yeah.
Because if you have too much or too little, it'll mess it up. Yeah, I know. I was like, when I had surgery, they were, the lady was like, all right, don't do this. And I'm like, what? Am I gonna kill myself? Right. And you signed in, right?
Yes.
Sweet. All of you.
Right.
All of you signed in.
Thanks for coming, guys.
Yep. Oh yeah, then I was gonna figure out if it was, okay.